bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hi everybody, welcome to Comcast Newsmakers. I'm Tony Hill. If you think that you can't make a difference in this world, we're going to give you information today that will completely contradict that. You can take maybe one day and volunteer and affect somebody in other parts of the world. We're going to talk about that with Dr. Peter Dirr, who is a member of the Board of Directors with Medical Missionaries. How are you?
I'm glad to be here with you.
Glad to have you here as well. And people are sitting at home and they hear me say these words, medical missionaries, and they think, I don't have a medical background, but you don't need one to get involved in help.
You don't. We have many physicians and nurses and dentists that volunteer time to help the poorest of the poor in the world, and they need a lot of support. There are a lot of ways that people can help by getting together. For example, there's a container being shipped to Haiti and the Dominican Republic, being loaded by 20 volunteers. We need people to do that type of thing. Before the container can be shipped, we gather clothing. We have people gather clothing and sort it and get it ready for shipping. Medicines as well. We have donations of medicines from doctors' offices, from hospitals, and then we get them and we package them and get them ready to ship. So there are a lot of ways that people can help on a volunteer basis.
Sure, and you brought along some photos which show some of those ways. First, we want to show some of the devastation in Haiti, and you'll see a photo we're going to show you here in a moment, folks. The flood there, the water right at the roof lines, and so obviously a very dire situation, but through the form of Medical Missionaries, help is on the ground. We'll take a look at the next photo, and this is a medical professional who's helping a lady here. Yes, we have a clinic that we have built and support in Tomasik, Haiti. And we have about 15 Haitians who are staff members there. They're supported by us, and visiting teams of physicians and nurses go down and they provide in-service education to those people and conduct surgeries and patients as well. Sure, and you spoke of helping pack those containers. Some folks are here preparing the medications, it looks like. Yes, it's very difficult to keep the pharmacy of the clinic stocked on a regular basis, but it's important for us to do that. You know, in Haiti, the people live on $700 a year. Wow. And that's their income for the year. They don't have clothing, they don't have good diets, they don't have potable water. Sure. And so all of these things are underlying conditions that lead to poor health. And we look at health in a very broad sense and try to go and help not only with the medicines in the clinic, but also by helping them get potable water, sure, have houses that will stand up to the flooding. So you're helping the poorest of the poor. They are the poorest of the poor. Haiti's only a couple of 100 miles from the United States, and yet the difference is unbelievable. The lifespan, the average lifespan in Haiti is 61 years compared to 78 years here. That's 20%, 25% more lifespan that we have, largely because of disease that exists in the country. Let's talk, sure. The child mortality rate is about 60%. About 60% of the children don't live to be age 5 down there. Amazing. Mostly because they get diseases from the water, and they're diseases that can be treated. This clinic that we have functions in a city of 60,000 people. It's the only health facility that they have. Wow. So these people walk for hours every day to come to the clinic. There are about 100 to 150 people a day that receive treatment through the clinic. And imagine being ill enough that you need medical attention and having to walk that distance to get that medical attention. It's an amazing thing. How can people who are watching now get involved? Corporations, private donors, citizens, what can they do? Well, there are 4 things. First, contributions. We certainly need contributions. It costs us $150,000 to $175,000 a year to run the clinic, and we rely entirely on contributions for that. And it doesn't take a lot to do some things. For example, $35 provides a package of treatment for a month to raise a child from malnutrition to be back in health again. Sure. $500 a day is what it costs us to operate the clinic. Right. So we need sponsors and people to donate money. All right, and then you just go to your website, give you a call, get the information, get involved and help. Thank you very much, because you're saving lives out there. It's a pleasure to be here. Pleasure talking to you as well. That is Dr. Peter Dirr, who's a member of the Board of Directors of Medical Missionaries.